Everybody loves Botox. Whenever people think of beauty, Botox is one of the top things that come to mind. However, are there certain situations where Botox may not help your beauty? Let's dig into it.
You Are Beautiful, podcast with Jae Kim, MD.
Welcome to the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a board-certified facial plastic surgeon. I'm on a mission to make the world a more beautiful place. I want to start with you. There are 3 core truths that you must embrace to start your beauty journey and achieve the most beautiful version of yourself. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's get started. A few weeks ago, I posted why I said no to somebody who asked for Botox just under the lower eyelid. I appreciate your feedback, and since there was enough feedback to ask for more information about this situation, we'll elaborate further on it today. We met a young female at the office, and she wanted Botox right under here, under the lower lash line, to help decrease this roll that happens when she smiles. This is a common ask of patients who come to the office for Botox treatment. The most common areas, of course, are between the eyebrows, where we have frown lines, on our foreheads, where we have horizontal wrinkles, and of course, along our crow's feet, where we have sun rays, or as people like to call them more fondly, crow's feet. Besides that, the other common areas include the masseter, that's our chewing muscle for when we have issues with too much strain causing headaches and the like. And one of the more common but still pretty regular asks for Botox treatment is right here, just below the lash line. So for those of you who are not as familiar with Botox, it is a series of injections that is performed in the office by a licensed aesthetic professional. It can be a doctor, it can be a nurse or a nurse practitioner or a PA. It cannot be somebody at the back of a salon who gets questionable Botox from somewhere else. We've been through that before. We've discussed it in a prior episode. You want to go to a real medical professional to get a proper medical treatment. This is for your beauty. However, there are medical and safety considerations that each professional giving this treatment has to know. So when it comes to this area, we have a muscle and it closes our eyes like this. This muscle is important because it protects your eyeball from foreign objects. Just reflexively, when something comes your way, your reflex is to blink so that your eye doesn't get hurt. And so this muscle is just under the skin, encompassing basically the area and around the entire eye socket. There are 3 areas to this muscle. If you go closest to the center, you have this area of muscle just along the upper and lower lash line. And this muscle, called the orbicularis oculi muscle, is divided into 3 parts. The first part here, right along the lashes, the upper and lower lashes, is called the pre-tarsal portion of the orbicularis oculi muscle. The tarsal portion is on top of the tarsus. We have eyelid plates along the upper eyelid and along the lower eyelid. These structures are important to the anatomy of our eyelids. The next area of this muscle is just above that or just outside of that in what we call the preseptal portion of the orbicularis. The preseptal portion of this muscle involves the saran wrap that keeps our eyelid fat in our eye socket for our eye safety. Then the most outside portion is the preorbital portion of the orbicularis muscle, and that may overlie the bony part of our eye socket. All 3 of these areas contract in this concentric motion to close our eyes, to protect our eyes from any harm that might come our way. The reason why people want the Botox injection right along the lower eyelid is because when they smile, they make what looks like a jelly roll. And that is the colloquial term for this hill right here when you smile. The thing about it is, I think it's kind of cute. And this is just me talking from some patients' perspectives, but some people actually desire that. And we call it a jelly roll because, it's a fun term. The thing that we see in a lot of Asian cultures is that a lot of people actually who do not have it want it. And so what they'll do is come for a little volumization right along the lower eyelid. That's a topic for another time. But back to the people who want to get rid of that, the reason that this happens is because this muscle flexes when you smile. And so you get a little bit of a hill right along the edge of your lower eyelid. For people who find it not attractive to their appearance, what you can do is inject a tiny bit of Botox to relax just that specific area of the muscle so that it does not make that jelly roll for a few months. We have a lot of patients who come to this office and get that treatment and are very happy with it. However, what's the caveat here? The caveat here is your eye safety. As I mentioned before, this muscle is important for the protection and safety of your eyeballs. If you inject Botox here and you lose muscle tone, what can happen is that if your eye tone is already weak to begin with, it can go like this and it can bow more. I'm exaggerating here. If you're watching on YouTube, I'm exaggerating by pulling down my lower eyelid with my Q-tip. And what you can see now is you can see the white of the eye under my iris. And actually, even when I'm pulling this lower eyelid down for these few seconds, my eye is starting to feel dry already. So I'm going to release my Q-tip and close my eyes to lubricate my eyes again. The point of the story here is that this patient had weak lower eyelid tone. This may be due to just the anatomy of the lower eyelid structure and or an inherent lack of strength in the muscle. Regardless, we said no to this particular area of treatment because there is a risk that this tone that the muscle is supporting will get weaker. And what may happen is a lowering of this lower eyelid so that it gets dry and itchy and irritated, and the eye is more prone to irritation and injury and the like. So back to the lady who came to the office and we said no to Botox under the eyelid. What options are there instead? The principle behind rejuvenating this area has to come from building structure along the lower eyelid, building structure and substance so that the risk of the lower eyelid folding out or bowing down gets minimized. So when it comes to non-surgical options to help rejuvenate this area, instead of toning down a muscle that is already potentially weak and you run the risk of safety issues with the lower eyelid, what you can do is build substance and structure along the lower eyelid and upper cheek junction. The non-surgical way to do this is with volume. Depending on the aesthetic professional you're talking to, and depending on their skill and comfort level, there may be filler or a combination of something known as PRF Easy Gel. This is reserved for cases of relatively mild aesthetic concerns. So the main concern that a lot of people have when it comes to aesthetics is actually kind of a hill right here where people normally see bags under the eyes. But what a lot of people miss when they look in the mirror is that there is not that big of a hill along where the eye bags usually are, But the other thing, and this is very important, is that the junction between the lower eyelid and the upper cheek, right about where my Q-tip is, right there, there's usually a shadow. And that shadow is an indication of lost volume over time. Now, you don't have to be super old for this to be an issue. If you have people in your family who had this issue when they were young, that is a reason that you might have it when you're young too. And I've seen people as young as 25 years old who have concerns about bags under the eyes, as well as, if you look at them closely, they have a relative valley here at the junction between the lower eyelid and the upper cheek. So the key to this is slow and steady in terms of one size fits all, or in terms of one-stop solution. This is really not the area to expect such a process and such an outcome. The key to this area is to go slowly, to go over multiple visits to the office to see your aesthetic professional, and to get that built up just right so that it doesn't bulge or it doesn't look unnatural or it just doesn't work. The thing about non-surgical treatments is that it's relatively quick. It's in the office, you're awake, you have relatively little downtime. The flip side of it is that you will likely need multiple visits. And on top of that, you'll probably need to check back in maybe once, maybe twice a year to make sure that you continue to maintain that desired appearance. Now, I mentioned nothing about weakening the muscle because you need the muscle. It's just that if your concern is that the muscle is creating a hill, that means that under that there's a valley. And so you want to boost that valley so that this hill doesn't look as high. You're not weakening the hill or you're not diminishing the hill. And the worst thing you can do is actually cut that muscle out because your eyelid needs it for the safety and structural support. And even if you're younger now, you'll definitely regret it when you're into your 50s and 60s because this will get weaker and your eyelids will inevitably bow like that. So please, just no cutting out muscle under any circumstance. I know that people kind of cringe when we say that to them, and because that's the main concern, is that this muscle is too strong. However, if you cut that out, you're going to regret it later. So if you're going to take one thing from this piece of content, just make sure that you don't cut out muscle, which is vitally important to the integrity and safety of your lower eyelid. Speaking of cutting muscle, there is a surgical option. The thing about this area is that you want to make sure that the support is strong for a good long time. And if there's any concerns, especially when you're younger, of there being not enough tone or not enough strength here, your eyelid surgeon may want to tighten that up. A lower eyelid tightening surgery can be done by itself or with a lower eyelid blepharoplasty to remove eyelid bags and or to smooth out the hills and valleys along the lower eyelid and cheek junction. This may involve relocating the fat from the eye socket over the top rim of the cheekbone, or it may involve grafting fat from elsewhere to volumize this entire area in a more comprehensive manner. The short and the long of it is, don't remove this muscle. And if there's any concern about weakness or bowing of the lower eyelid, kind of like mine, the last thing you want to do is weaken that muscle temporarily with Botox, and even worse, weaken it permanently by actually cutting out some muscle. So those are the things you really do not want to do. I've seen aesthetic professionals being burnt before when people who had lower eyelid surgery wanted a little Botox there because their crow's feet extended along here to the middle of the lower eyelid. And when you inject Botox here, and somebody's had surgery here before, the chance of this causing issues is greater. So I don't want you to miss that. And I know that a lot of aesthetic professionals know this concept, but it's a reminder for all of us to do right by our patients, to make sure that we understand our anatomy, even if it's been surgically altered or altered by some other procedures, and to have that all in consideration when considering our desired aesthetic outcomes for our patients, as well as their safety. So to recap, a lot of people ask for Botox along the lower eyelid because they feel it will be aesthetically pleasing. It is our job as aesthetic professionals to determine whether that procedure is safe and whether it will yield the desired outcome. If there is even more than a hint of a consideration that this may not be the safest procedure, then it is probably best not to do that procedure or consider options. I want this video to be helpful for prospective patients and aesthetic professionals alike. As aesthetic professionals, we have a responsibility to our patients to offer the most effective treatments as well as the safest treatments. No procedure is 100% risk-free. Every procedure carries a certain risk, however minor or major. It is our job to consider these risks and convey them to our patients so that we can formulate a great plan, a good aesthetic plan to help our patients achieve their desired goals. If a patient's aesthetic goals are directly inconsistent or conflicting with safety parameters, then it is better not to do that particular procedure. If there is a concern that the patient will be unhappy with a certain aspect of the procedure, and there is more than a small chance of that, then it is probably best not to pursue that treatment with that patient. Again, everybody loves Botox, and so we're all excited about how it can best help our beauty and ultimately change our lives. And Botox can be life-changing. The thing is, I don't want it to change your life in a bad way. If this video resonates with you, if this content is something that you take and say, I want to learn more, or what else is there about our aesthetics and safety considerations, please leave your feedback. We always love comments about how this video resonates with you and what else you would like to learn more about. You can also email us at podcast.youarebeautiful@gmail.com, and you can ask for certain guests to be on the show, and we'll try to get them on if we can, as well as other content related to achieving the most beautiful version of yourself. Again, thank you for tuning in to this episode of the You Are Beautiful podcast with Jae Kim, MD. I hope that you learned something and that you have more tools in your arsenal to help achieve the most beautiful version of yourself. I'll end with our 3 core tenets. Once again, you're beautiful, you're unique, and you are worth it. Till next time, take care, everyone.